And the problem here is we always think we are prepared. We're not 100% prepared for situations like that. When you are in a situation of high stress, you don't rise to the level of knowledge or your knowledge. You fall to the level of your preparation, and you pause and you get clarification of the situation. You can act better, and the speeds you become better. No one gets a position to make high stakes decisions if you don't have a team with you. You're never alone on this.
Hello, everyone, and welcome to the Paratus Podcast, the Emergency Preparedness Podcast. Very excited today to speak decision-making under pressure. And we have with us Dr. José Carlos Rodrigues Jr., who is a neurosurgeon and leadership consultant based in Brazil. He serves as a chief of neurosurgery at a major public hospital in Sao Paulo and has over 2 decades of experience in high-stakes surgical decision-making. In parallel, he specializes in applying neuroscience to leadership and decision-making under pressure, working with healthcare professionals and executives. He's the center of the Leadership Brain, where he shares insights on how the brain influences performance, judgment, and behavior in critical situations. Dr. Rodrigues, thank you so much for taking the time and being here with me today.
Thank you, Jean. It's a great pleasure to be here. I'm very excited to contribute with you on this exciting topic.
Absolutely. I totally agree. And to get us started, I'd love to set you off with a question. So please tell me, why do different professionals make different decisions under the same level of pressure?
Yeah, that sounds great, and sounds it's a great and a difficult question to answer. So I have to use some background, some examples to explain you how to do it. So I'm a neurosurgeon, so I deal with extreme cases, in urgent scenarios. But when you look at that, you think that people that are dealing with urgent cases are more prone to make good decisions. It's a big mistake. The same stakes are high in executive scenarios and more calm environments. And I try to explain this with 2 cases and make a parallel between them to explain how we make this. So the first case is a medical case. I know we work with emergency care, so it's very common for people that are working this scenario. So let's talk about a young girl that is home, feels a severe headache. Normally they call it the worst headache of her life, and fall down unconscious. So they are come to the house and try to stabilize her and move to the hospital. Normally after this condition, the ones that survive wake up in the ER because there is a rise in intracranial pressure, the brain stabilizes and go on. So at the hospital, they make the diagnosis there is a subarachnoid hemorrhage. There is an hemorrhage that comes for a rupture aneurysm. It's a very urgent case. And we call benign, but it's not benign for me. You can kill a lot of people, unfortunately. So that's come the first decision. When you have an aneurysm, you have to take a decision if you let's do urgent surgery. Let's wait for the brain to stabilize and things like that. What is done is what you do is an open surgery, and there is more common ER than the endovascular approach. Go to the surgery, there is a lot of things that you have to do. Firstly, is a young woman, there is a family behind her, he has a lot of life to expand, and you have to work to give her a chance to come back to his life completely well. So when you go to the surgery, the aim of the surgery is to obliterate the aneurysm. We put a clip on it and close it to avoid any other hemorrhage. So when you start doing surgery like that, normally everyone in the surgical room are stressed because everything can change from a calm moment to a tragedy. So just to explain, it's not about case, it's about the decision making. And when we went to the surgery, if the surgery went well, everything is good, it's okay. But there are some scenarios that are not so good. Let's imagine that it's the case, the surgeon are doing the surgery, everything is working as planned. You found the aneurysm, you thought the next when you put the clip to close it. But when you are trying to put it, the aneurysm re-ruptures in the surgery. And this is not an uncommon situation. And when this happens, it looks like a chaos. You have a massive bleeding. It's hard to look at microscope. Everyone in their room, or they get freeze, or they start screaming. And this is the situation where you have to take a decision. What do you do? And this kind of decision will be very important for this patient, because the decision you make can lead to the patient to live, to die, or to live with a permanent death or worse. So this is a situation in high stakes, and when you have to take an important decision. And the problem here is we always think we are prepared. We're not 100% prepared for situations like that. So I stopped this case for now and make a parallel with another scenario, just to make a comparison afterwards. Because I started working with leadership, as you mentioned, and I saw there are a lot of parallel between leadership, surgery, and everything in the way we took decisions. So let's imagine a company, a car company, and the problem in these big companies is that when there is a problem, some safety issue, it lasts too long to become visible. So, for instance, there is a problem, a faulty brake in the car and the line. But no, don't care about this. Let's continue to prepare the cars, something like that. And normally there is no. The first decision is we will mention this and stop all the line of the car, or we continue. Normally the decision is to continue, because it's too expensive to stop producing it. So that creates a huge problem in the future. But then the crisis could escalate. If there is a huge accident, an accident with someone that is important, some political guy, some arts, or thing like that. So this creates a situation that is really hard to handle. Media exposure, public pressure, stakeholders pressure, shareholders pressures, and things like that. And now the decision is made under pressure. So where is the comparison? That is not because you are not dealing with the aneurysm, they don't have to make an urgent decision or situation in an early setting. So the decision must to be made under intense pressure. So what I use this case is to show that for the brain, there is no difference if you took a decision in the surgical room or the boardroom. There is no difference. You are took a decision under pressure. So that's why I started explaining why people took different decisions, different scenarios, but in essence, they look out the same.
That's really interesting. And I can certainly feel that myself, and I'm sure you too, when we're in a medical situation and we feel stressed, and then we might in our personal lives feel stressed. It's the same stress. The physiological response is the same. So the decision making, wherever the stress comes from, is certainly the same. That's really important and interesting. If you had to go into detail a little bit more in terms like decision making under stress, can you break that down into kind of different parts? Is there a way to approach this?
Yes, sure. I will continue this explaining based on the case. It become more clear for everyone. What do you have in these two scenarios? The first case and the second case, they have the same. They have cognitive overload. There is too much information that is hard to handle. And this creates a lot of ambiguity. You don't know what is real information, what is your brain thinking, oh, this could happen or is not happen. So there is a lot of pressure. And there is time pressure. In the aneurysm case, there is seconds to take a decision. But in the executive case, you have sometimes hours to take a decision. There is a lot of uncertainty, as I mentioned. There is big incomplete. There could be that you are envision something that is not happening. You get confused about it. And as we start mentioning, there is emotional activation. So it comes fear. How you deal into risk, into responsibility. That's all that is at stake at this moment. So when I have situation like this, even for executive leaders of our neurosurgeon, I explain this is the moment when the trainer starts becoming a leader. So you are putting leadership in the room now. It's not a training. So under these conditions, the brain shifts from deliberate thinking, for analytical thinking, to a reactive behavior. And this reactive behavior, it's a big problem because we have two structures, of course, making a short summary of how the brain works on this situation. But we have two important structures on this. And the first one is the prefrontal cortex. The prefrontal cortex is what separates us for our evolutional friends, let's call this. And our prefrontal cortex that what creates a notion of creativity, notion of reality, time passing, everything is there. And is our critical part of the brain. Is the part that stops, analyze, and makes a decision based on experience or knowledge and everything like that. And the opposite of it is the amygdala. A lot of people discuss about the amygdala. It's crazy because it's a nut-shaped structure that is very small. Look deeper in the brain, different from the prefrontal cortex. A lot of animals have amygdala. It's the same because they react to fear a lot. And when it's activated, the first reaction is to release a lot of stress hormones. And these hormones create a lot of different behavior. So you start sweating, your eyes get open, you make a contraction. Everything is the situation of fight, freeze, or flight. When we are under a situation of high stakes decision in surgical room, the boardroom, it activates the same mechanism, the amygdala. And what is the problem? If you keep your amygdala activated, it inhibits the prefrontal cortex. Your decisions will be more based on fear responses than on analytical response. Of course, there are ways to improve this. We will discuss later after, but at this moment, that's the problem. I like one phrase that I heard once that when you are in a situation of high stress, you don't rise to the level of your knowledge. You fall to the level of your preparation.
I love that.
So yeah, the first time I heard, I took note of it because is this you can use your knowledge the same way we use it now with critics, being analytical, thing like that, because everything that is coming that the amygdala is activating, you create a situation that you depend on your preparation. That's why given insight is one of the tools I think we must share for people to become better on it.
That's really interesting. By the way, I love a neurosurgeon explaining the parts of the brains because you actually see them for real. So I loved your description. I want to get back into the breakdowns, but I'd love if you could start talking a little bit about, you told us what happens. Is there a way to control that? And does that go back to all these different breakdowns? How would you approach that kind of physiological response?
Okay, I will only move back a little just to explain what this is, all this situation caused firstly, and how. But the first thing that happened is that you lead to premature decisions, and these premature decisions, they go to a lot of mistakes. There are a lot of studies, especially in business school, that people, if they have time to think, they took a different decision in situation tests on real life. You have at the same time, what occurs is a narrow thinking. You normally decrease a lot of perspectives to only one. And when you decide that, normally you follow it without even analyzing if it's the correct decision or not. Other problem, there is an over-reliance on intuition and experience. Of course, I have kind of this, but any situation is similar, but it's not the same exactly. Every patient has a different anatomy. It's not the same. Each aneurysm is a complete different aneurysm of others. So it's the same. And what is most important that happen with things that creates a lot of problem is there is a breakdown communication. And there is a problem like that, everyone stops communicate properly. Or they get freeze, it's complete silence. Normally when this happens in the surgical room, there is complete silence. Or a lot of people are screaming and talk at the same time. None of the situations are good to help it to this. So that's the problem. with this, how you can recover to make a good decision. I thought this to go to your point, how to recover to your standards to avoid these patterns of disrupting decision making. If you want, to can explain the tips and tricks, let's say like this,
Yeah,
to
absolutely. No, that makes total sense. And I love the fact that, here are the consequences of, these things going on. So yeah, perfect. And sorry for jumping ahead. Take us now to what kind of tools what are the solutions or mental models that we can use. And after that, I'd love to circle back and go and break down a little bit the individual pieces, but go ahead.
yeah, yeah. So that is, if you look for the internet, the literature, there are many solutions for this. But I like three that for me they work really well. So this three can be good advice for everyone. The first one I call strategic pause. It looks paradox, but it's better to pause to act correctly. Normally, that's the big mistake that people think if they are pausing, they are not reacting and they lose speed. But it's in contrary. And you pause and you get clarification of the situation, you can act better and the speeds you become better. So it's the opposite. You are pausing to get better speed like that. Then next is you can ask if you can.
Yeah, I was wondering, what do you go into? What do you do exactly during that pause? Because I could see how you can break that down even a little bit more.
Yeah, yeah. Yep. On the pause, I do what are the other two tips. The first one is to recover your pre-structure thinking. What is that? If I went to the surgery, I normally discuss with my residents, the nurse, the anesthesiologist, this is the kind of surgery, this is the how the patient is now, and this what could happen, this is what you do the surgery. But I always discuss with everyone, this could happen this way, and you do this. So it's a pre-structure thinking. It's like the firefighters behave. They envision a lot of different scenarios. The SEALs do the same too. And when they happen, this. And what is interesting in your brain, if you are imagining some situation or if you are experiencing a situation, for the brain, there is no difference.
Hmm.
It reacts at the same way. That's a lot of people have fear of darkness, let's call it. If we are feeling darkness, the reaction the brain are the same. Their fear or spiders, for instance, and people imagine a spider it reacts. So that's why when we are before surgery or before any situation, think step by step, you are envision it. When you enter in the procedure, you go straight away without a big effort to make each decision. So when a situation like that happen, I pause and try to rethinking my pre-structure uh, plan. That's one thing. The other thing that I really like to do is to externalize this thinking. That's a big problem. A lot of people they oh, I am in control. Stop talking. I will do this. Is a big mistake. You need your team. You need have people to help you. So you have to okay. So let's explain the surgical case. This aneurysm is rupture. I think that you have to do this because of this or this or this. I need for you this or this. If you explain this, communication re-stabilize and you recover it. So people are talking each other, they have a so a leader even in a surgical room or in the boardroom is the one that will say, okay, we will follow this way. If people don't have this, it's worse if they are acting incorrectly. So they need a direction. The ancient meaning of leader is create direction for a long time ago. So it's the one that show the path. That's because that's the real role of a leader. So just to summary, so it's a strategic pause, just to stop, take a breath. Okay, this happened. What is the next step? And when you have experience and you have preparation, you know what they are. That's something we can discuss more. But you have to recover this and communicate this. If you communicate this, you have your allies together with you and you can handle this with help, support, and try to achieve the best result you can on that situation.
I love that model and very clear steps. I find it very interesting that the model is based on things that you actually have to prepare ahead of time, right? So even if you have this model, if you don't have a prior structure, then you can't recover your prior structure. So that's interesting that you need to have set a prior structure. And also I'd be interesting to hear you talk about the externalizing and team aspect, because I'm sure that if you just do this for the first time without having done it before, or if you don't know your team, or if you don't know they're going to act this way, maybe it might not work. So is there an aspect of preparation to the externalization and communication aspect as well?
Yeah, absolutely. Normally in high stakes, no one gets a position to make high stakes decision if you don't have a team with you. You're never alone in this situation. Some people think they are solo leaders, but is is a lie. No one is a solo leader. So you need people. This part of communicate, even if you don't know what to do, it's important. If you thought, I don't know what to do, I don't know what's happened, because you open a door to others to, oh, I think this, I think that. So other perspectives come to help you to with decision. What happens in most situations, there is a problem. One guy, I will do this, I will do this. No one is speaking openly. You don't have a psychological safe space, you call this in business, and no one is talking. So if you, because sometimes for a different angle, someone is looking for a better option that you didn't envision.
Mm-hmm.
And I like to do this. I communicate, I will do this. And I normally ask, everyone's agree with that. It's a way to create connection and give support and power to your colleagues to stay with you and have responsibility in the case as you.
When you spoke about prior structure, for the medical part, I really see this where we're going into an intervention. Here's what we have in front of us. Here is plan A, plan B, plan C kind of things. We do this in emergency as well. For executives, how do you translate that to their setting? Is the prior structure idea kind of based on, what they're gonna do? Because there are so many situations in the boardroom that could happen. Whereas when we're going into an intervention, we probably have, things planned a little bit more. So how do you translate to the executive setting?
Yeah, thanks. Good question. I need some background to answer it. The first thing that is there are some problems in the medical scenario. ER, not your case, but as I say, people normally train if the things happen in a positive way. People don't train the worst case scenarios. That's a big problem. There are a lot of people that spend a lot of training. Oh, I do this. I can do a surgery, and when they have a rupture, they don't know what to do because they don't have this kind of training or this kind of mindset. So that's just to include that there is a lot of preparation, but there is a lot of mistakes because the preparation is incorrect even in medical case and in your scenarios. People normally think what I do, but they train only if the planning is going well, not if the plane is not as good as they thought. For the executives, of course, the difference for the executive is that you have to think this, but not in moments like in or in the surgical room. You have to think this in short term, middle term, and long term. Let me explain this. Remember the case that I explained about the weak sign of a failure in the brakes in a car company. That leader, even risking a loss of money because you have to stop this, you have to think of the consequence at short term, mid term, and long term. And that is preparation. If I do this, what is happen? Or if I do this, what is happen? So even if everyone took a decision, we will not communicate this, we will go on. He envisioned that, okay, if this escalates, this will lead at this, and I have to prepare for this. The executives are the ones that must create people to imagine the most difficult scenarios. The economy is crazy nowadays. The political are crazy nowadays. Regulations are crazy nowadays. So have to look at this and look ahead. A good leader and a good CEO is the one that is always looking 2-3 steps ahead. Think if this happens this way is this, if happens this way is this, to get prepared. You have to explain this to your team to get them prepared too. It's not only the CEO that must be the one prepared. And you have to I normally say this: you have to train the worst situations in a calm times to have a calm time in a worst case scenario. It was we face at the COVID-19 pandemic. The ones that are thinking a little bit about crisis do better than the ones that, oh, this will never happen, everything is good. And so we saw completely different reactions in different hospitals depending of their thinking about possible or crisis or not.
Yeah, that's really interesting. So I love the fact that it's the same principle finally. You're trying to think of what are the possible situations. And so when it happens, then you've at least started thinking initially about how to address this. So that certainly goes to recovering the prior structure. I love that. When something happens, people sometimes get overtaken by emotion, like the stress response or the emotions are really strong. The method that you've described is the pause the way to kind of overcome that physiological response, or is the fact that you're more prepared? How does that address that really kind of emotional and physiological response aspect?
Great question. Uh, I like to think that different people have different reactions to emotions. They have different ways to recover from it. Let's explain this better. For me, what works really well is take a breath. When I take a deep breath, normally I calm down a lot. Maybe it's because I practice meditation, thing like that. Anyone can adapt to it. For some people, it's just screaming. I know a guy that it screams a lot and then is back at a good level. You have to find your best way to release the pressure and calm you down. And when you train this, you have to train this before the situation arrives. You can train this in esports, you can train this in tests, you can do this in simulation and things like that. Because you need to have a way to release the pressure. No one can handle with a lot of pressure inside their heads. No one, no one. And what releases the pressure most is when you realize, okay, perhaps a different scenario, but I am in control yet. And how to realize this? If you had a pre-structured planning that this situation was already discussed, okay, it changed for this direction and I know how to do. The most important thing to calm down yourself, get control, is when you have clarity of what happened, what you have to do. And to achieve this, as I mentioned, is pausing, take a deep breath for someone, screaming for others, reanalyze your planning and say, okay, I have clarity is this, communicate and go to that direction. So this will happen. But at the end, each person is different to find the way to release pressure. A lot of people, not in surgical home, of course, like to eat and they are stressed and they eat some, especially sugar foods, they calm down. There are a lot of people that do that. You have to find yourself. That's why what is most important for this to add is to be aware of how you react to pressure. There is no general recipe for that. Each person reacts different. Normally people, they try to correct the others or to instruct the other how they have to react to pressure. But no, you have to know yourself, be aware of how you react and how you can calm down and stay in control once again.
That's a great segue into, I wanted to ask you about, we talked briefly about uncertainty and also experience. I find these two are tied together. And now it's interesting that you're bringing the fact of knowing yourself certainly is part of that, but also probably knowing the clinical situations for a doctor, but also the, business situations if you're an executive. What do you find is the role of experience? Is it always good? Do you still have to be careful? Like someone with 25 years experience, can they not be ready for these situations, or do they have to approach this in the same manner?
Yeah, another good question. Very interesting. Here's another paradox. Experience can help you, but can make you fall down very, very fast. That's because if you're doing some kind of thing for 20, 25 years in the same way without any other perspective, probably is working, but there will be a situation that is not the only solution. You have to looking for other solutions. Experience is good when you are open to increase your experience to another one's perspectives or different scenarios. That's why the great advice here is you must to be a perpetual learning, because there are a lot of people that have a lot of experience, but they are doing the same things the same way the entire life. We saw this mentioned COVID-19 once again. A lot of people start reacting the same way, but it's a different case. You can't react the same way. But what is good in your experience? If you have this clarity that you have to restructure your thinking, if you're always open to learning, if you communicate well, probably your experience is the best thing that you can use when you have a different case, because you normally handle things well. And that is the same when I mention about unlimited, you have limited information in a situation of high stakes. Could be limited because you don't know what is happening. You can recognize, you never think about it. It's not only the scenario. It could be you have limited information too.
I love that. That emotional response or that physiological response. Do you think there are advantages to this? I mean, obviously, when you go back thousands of years, the advantages were a lion was running towards us, so you needed to run away as fast as possible. Is there a way now during that pause and with the model that you talk about to kind of optimize or use that physiological response? Or are you really just trying to suppress it as much as possible and go on with your steps?
Yeah, great question. The simple question is no, don't suppress it. You need some. That's because it's what keeps us alert and aware, and in a situation change even. So if you're not too aware, something can happen you don't know, you didn't notice, and things can get worse. So when something is happen in a way you're not expecting, you start having this reaction of fear or thinking, oh, it's not good. And this feeling is really good because you are becoming aware of what is happening. This you don't have to suppress. If you suppress this, you're not looking for it. So it's a discomfort that is needed to become aware. But the problem is when this situation escalates and you let it control your decisions. This will happen when you are in a crisis. You mentioned and in your evolution, you have this. If you heard a noise that could be a lion, run without looking if it's a lion or not. But today, normally in many cities, you don't have a lion in the street. So if you heard a lion's noise, why you're with fear? The problem is what I mentioned previously, that your brain don't know the difference between imagination and reality. It's the same. It's the same. That's why a lot of people with psychosis, they have this because their imagination creates scenarios and they think they're real. And the answer to the brain is happening in a real scenario. So here is to understand how to handle this and to face or have to recognize that it's happened, this alert of fear, and know that's why you have to know each point you have to start releasing the pressure to avoid it to escalate and to release the press with the tools I mentioned before.
How do you think people can train that? Because obviously, certain people would be exposed to these situations more often. And, when you do that for real, then you probably become better and better. But let's say I want to practice this model and put it in practice. And obviously, I'm preparing, talking to the team about my structure. I have the team prepared and everything, but most of my cases go well or most of the situations go well. How can I prepare or practice for this?
Yeah, great question. First, not try to correct you, but that is not because someone is exposed to a lot of cases that he learns how to react properly.
Interesting.
I know a lot of surgeons, they're old guys, they're operating a lot. Situation, once they scream, they don't have control. There are people that are not open to this. It's the same with executive. There's executives that always blaming. So exposure is not equal to good response to time. The first thing is that. The other thing is to think that this could happen. There is the preparation that we already discussed. But the preparation must not be only about that case specifically, that scenario. It's be how you react and how we prepare us. We live in a world that is crazy. There have a lot of problems, safety problems, political problems, wars happen. If you don't prepare yourselves to not be in a reactive state, you live very poorly. So how to handle this? Of course, it's having the best lifestyle for you. For it, you have to eat well, sleep well, practice exercise. But there are some specific tools or techniques to how to handle stress. For me, really help me is meditation, mindfulness techniques. I really
Yeah.
love that. But I really love to envision practice. Normally, when I have a surgery the next day, the day before, I envision the steps of the surgery a lot of times. It happens a lot. There are a lot of practice. Sports is a good way to start for this. If you play golf, you don't handle stress, never will be a good golfer because uh, each shot, it's a hard shot. You have to if you react it. But I love to play golf. It happens a lot. There are some people there. They have to, as I mentioned, to put it out, to screen. To other people have to run 5, 7 miles. You need to know yourself, but you need to avoid thinking, oh, I will see when the situation happens how to handle it. No, you have to know you before. So think about how you live in this world that is a crazy world. How you do to get prepared to get crazy. So you go to exercise, you study, you are working with good people, create good things. It's the same for situations like that. You have to prepare yourself how to answer when the pressure is high. And once again, know yourself how to do that.
Great answer. Thank you so much. That's really insightful. So let's go back to your case, Dr. Rodriguez, operating the aneurysm ruptures. So take us to that moment, and obviously you can't pause for 15 minutes. So I'm imagining this happens fairly fast. So yeah, take us to exactly that point. What goes on in your head? How do you manage this? And then maybe we could do the same to go over the case with the management situation.
For a good reason or not, unfortunately, I saw a lot of ruptures because I work to residents, and they are not too skilled to make a decision. So I think it's even hard because you're seeing another one doing this. You have to correct the others. The first thing is to stay calm. I think the people that are not calm, they are in. So I have to stay calm. So when a situation happen like that, and as I mentioned, in 25 years, it happens many times. What I do is okay, how I control this bleeding. And there are many ways that I already training and I had thinking to. On this case, the rupture is here. I can have control of the carotid artery and stops bleeding. Oh, no, it's a situation and the carotid is not here, but I can put a clip through the aneurysm, even if I'm not perfect control and then put it together. But the first thing is this, is to stay calm. Situation, even as you mentioned, you can pause for 15 minutes, but you can pause a little. Just think, okay, this happened and now. But what is the best thing for me that because I practice this a lot, I envision this a lot, the reaction is almost automatically. That is the great thing. Your brain, as I mentioned, when they are in a high state situation, they go to the state of knowledge, to the state of preparation. If you are prepared, your reaction is automatically because our unconscious mind is the responsible to look for pattern reaction. So it recognizes the situation. This situation, you have to react this. So everything you do consciously goes to our conscious mind, and when you have that reaction, that situation similar next time, our reacts go easy. You don't spend a lot of energy, a lot of time, a lot of this. So that's the situation. So what I do in this kind of surgery is to calm myself down and do that steps I said about externalize, communicate, and do that. And normally, you can achieve control, and the surgery can finish in a good way doing these steps. Looking for this active case, what I recommend is the first thing is calm down too. Calm yourself. But what is different here is that you have to looking for information, important information, because people normally took decision based on a small amount of information, and that's when the decisions are very poor. Looking for what is happening in different, looking and try to talk with the one that are the front line of the problem. That's another problem. The people that are in the high position hierarchically, they took decision based on only one perspective, their perspective. But The one that is leading with the problem and is the one that normally had a clear picture of the scenario and have a better solution. We normally call this a root cause analysis, and looking for what is happened, why is to you learn, ask 5 or 6 whys until you get the answer. The next step is to, clearly communicate, based on this, the next decision is this because that's, and communicate everyone that will be involved. Everyone, the media, shareholders, people that are working with the machines or things like that. Everyone wants to know why that happened. Because if you don't say this, people will not follow your plan. It can be a huge problem to achieve the results you want. The answer, if you see a parallel, is almost the same as surgical room. The difference is the step is a little slower, but the responsibility are for not one person in the surgery, is for a lot. And so that's why different scenarios, different decisions, but for the brain, it looks very similar.
Absolutely. And I love that the concepts are the same. So, we talked about preparation, the pause, and then, your steps, and obviously having the team on board and communicating. I love that. I'll try to look for that type of response and model because obviously a lot of businesses, be it public or private, it's in the news sometimes when these events happen. So I'll certainly look forward to how the executives respond and try to see if they applied your model. So that's going to be an interesting experience.
Unfortunately, it's not so frequent. We are teaching this for some executives, but it's culture. The old style leadership is not prepared to make this, unfortunately. But
they can learn. It's not too late.
The way the word is ambiguous, complex, if you don't do a reaction like that, although prepare to have reaction like that, you will not answer correctly and not take a good decision.
Yeah, I love that. Before we end, Dr. Rodrigues, can we do a few quick fire questions? So I would just give you a quick question and love to get your immediate thoughts. Does that sound good?
Yeah, sounds good. Yeah.
All right, let's go. Have you changed your mind about something in the past year?
Changed a lot of things, but I think one important thing is about the role of pressure in performance. A lot of people think that you have to feel and resist pressure to be a good performer. But as we already discussed, it's not that. You have to know how to release the pressure to achieve clarity and be a high performer. So that's something that I study a lot and the next few years, but especially in the last 2 months, that people need to achieve clarity, and the way to achieve clarity, to answer correctly, is to release pressure. People say, must be strong, have to be the stronger one and support that. No, you have to know how to release it to achieve clarity and so on.
What are you not asked often enough regarding either your professional career or the coaching that you do, maybe, that you think that people should be asking more often?
Another interesting question. The most frequent question people ask too is, if in this situation, what I do? If in this situation, what I do? I don't have to give this answer to you because you must analyze your experience and things and see what is the best. A coaching, a mentorship, is not for that. I really would like that people ask me how I prepare my brain to answer bets if that scenario occurs. I think it would be the best. Because as I mentioned, I've seen something like that how to get prepared, because rephrasing once again, you don't go to your level of knowledge, you fall down to your level of preparation.
Absolutely.
Yeah.
And last question for you. What makes you optimistic for the near or medium term future?
I'm optimistic. Something like that happened with us today is the better intersection between knowledge. As I move for a neurosurgeon to study leadership, to study neuroscience, to study leadership. So I think the best prepared profession in the future, you'll be the one that could add knowledge for different science or different fields to integrate the knowledge to answer correctly. So I'm very optimistic as you invite me because I made a connection, leadership and neuroscience in executive. It looks new, but it's needed. If you don't do this, you can answer correctly, especially in the evolving future. So I'm optimistic that people are feeling the need. Oh, I can be only a neurosurgeon. You need to do more. Can be only a IR professional. You need to look for that. So that's I optimistic, and I am helping to make it happen.
That makes me optimistic too. So I totally agree. Thank you so much, Dr. Rodriguez, for your insights. Very interesting discussion. So thanks again so much for taking the time.
Thank you, James. It was a really great pleasure. I really enjoyed to have an open space to speak of the things that I really enjoy it. And I'm always prone to help you when you need. It's a pleasure.
Thank you.
Thank you.